This is a lateral view of the right side of the face, and you'll recall that the skull has been sawn in half, so I'm going to flip this down to expose the two medial surfaces of the skull, the midline surfaces. Looking inside, there are some familiar structures from the last dissection. You'll recall the levator palatini muscle and the tensor veli palatini muscle, both of which are originating from the lateral and inferior aspects of the auditory tube. And here's a familiar structure, the opening to the auditory tube. Now this first part of the dissection is to inspect the nasal cavity and look at some of the structures that are in the nasal cavity and try and get a handle on the structures that drain into the nasal cavity. First of all, there are three spaces created in the nasal cavity by these protrusions into the nasal cavity known as the concha. This is the inferior concha, this is the middle concha, and this is the superior concha. And the spaces underneath each of these concha are known as the meatuses, this then being the inferior meatus. And if I flip the inferior concha up, we can look into the inferior meatus. One structure drains into the inferior meatus. That is the nasolacrimal duct, which comes from the lacrimal sac that you found when you dissected the orbit. So that would be the only structure that drains into the inferior meatus of the nasal cavity. The middle meatus of the nasal cavity is a little bit more complicated, and if we elevate the middle concha, we can look underneath of it and we see that there are actually a number of openings into the middle meatus. The middle meatus drains the frontal sinus into this groove known as the hiatus semilunaris. This is the groove of the hiatus semilunaris. And the frontal sinus drains directly into that groove. It also drains the largest sinus of the skull, the maxillary sinus. The maxillary sinus opens directly into this area underneath the area of the hiatus semilunaris as well. And then the anterior and middle ethmoid cells open onto this bump, which is known as the bulla ethmoidalis. Those are all the structures that empty into the middle meatus. You will also possibly be able to see the superior concha and the superior meatus in some of the cadavers, but in others it gets difficult to see. We can get an idea of what it looks like in this particular cadaver. You can see the superior meatus underneath the superior concha, and only one of the sinuses drains into the superior meatus. Those are the posterior ethmoidal cells. And then finally, above the superior concha is another little space known as the sphenoethmoidal recess, which drains the sphenoid sinus. Now that we have reviewed the structures of the nasal cavity, we're going to destroy the lateral wall of the nasal cavity in order to gain access to the important area, the pterygopalatine fossa. The pterygopalatine fossa lies in this region right here, and it gets a number of important nerves and vessels that come into the pterygopalatine fossa, and a number of nerves leave the fossa to innervate structures like the mucosa of the oral cavity, the mucosa of the nasal cavity, the skin in the region of the maxillary division of the trigeminal nerve, as well as a number of distributing centers for the parasympathetic fibers to the mucosal glands. In order to dissect the pterygopalatine fossa, the first thing we need to do is peel this mucosal lining away from this lateral wall in this area. And that's the first step that we're going to do in preparing for the dissection of the pterygopalatine fossa. For orientation purposes, this is the hard palate, and this is where the hard palate meets the soft palate. And what I've done in this dissection is I have broken away the wall, the medial wall of the maxillary sinus, to expose the entire maxillary sinus down in here. I've also broken away the palatine bone to expose the palatine canal, which houses the greater and lesser palatine nerves. Here's the greater palatine nerve, which supplies the hard palate, and the lesser palatine nerve behind it, which supplies the soft palate. These two nerves both arise from the pterygopalatine ganglion, which can be seen right here as this small swelling. the main contribution to the pterygopalatine ganglion is the nerve of the pterygoid canal, which comes in at the base of the sphenoid sinus. This would be the sphenoid sinus. And part of that canal has been opened up to expose the nerve of the pterygoid canal, which can be seen right here. The course of that nerve comes under the sphenoid sinus and enters the pterygopalatine fossa to supply the pterygopalatine ganglion. If you go inside the maxillary sinus, you can see a nerve that basically shows up just underneath the bone, very thin lamina of the bone, as the infraorbital nerve, and that can be seen right here. This nerve is one of the first nerves you saw in the dissection of the head and neck when you exposed the infraorbital nerve as it came out underneath the orbit to supply the skin. Now, one of the reasons why you want to look for this nerve early in the dissection is because you can trace it back and see where the maxillary nerve, the V2, comes out of foramen rotundum, which can be seen way inside here. There's the maxillary nerve, or V2. The maxillary nerve also has a contribution to this pterygopalatine ganglion. The infraorbital nerve gives off small branches to the teeth, the alveolars, which can be seen underneath the bone. And a small nerve, the zygomatic branch of the maxillary nerve, courses across the floor of the orbit. You may or may not be able to see this in your dissection. The next stage of the dissection is to view the larynx, and we're going to start by looking at some of the boundaries of the larynx. First of all, the opening to the larynx is known as the adytus, and that would be the boundary that's marked by the epiglottis, the fold between the epiglottis and the arytenoid cartilages, known as the aryepiglottic fold, one on this side and one on this side, and then the arytenoid cartilages, which are sitting on top of the cricoid cartilage. That would be the opening to the larynx. Superior to the epiglottis are a couple of structures that you should note. There is a fold between the epiglottis and the tongue, known as the median epiglottic fold, which can be seen right here in the midline. Then there are two lateral glossoepiglottic folds, and the pits between those are deep pits known as the valleculae. Looking down inside the larynx, you can see a couple of bulges on the lateral walls. The highest bulge is known as the false vocal fold, seen right here, and immediately below that is the true vocal fold. There's a slight depression which is situated between those two folds, known as the ventricle, or the ventricular space. The next thing we're going to do is look at the posterior aspect of the larynx by laying this down, and we're going to peel the mucosal linings off of the back side of the larynx. So I'm going to peel these two linings off, and I'll do so with a sharp scalpel and a midline cut. To expose the muscles that lie underneath the mucosal lining. Now that the mucosal membranes have been peeled away from the posterior aspect of the larynx, we can see a very large muscle, the posterior cricoarytenoid, which starts at the midline of the cricoid cartilage and runs laterally to attach to the muscular arm of the arytenoid cartilage. So you can see this muscle on both sides, one over here and one over here. You should note that this is the only abductor of the vocal folds. All the other muscles are adductors or tensors or do various other things. Other muscles that you may be able to see if you are careful in your removal of mucosa are the oblique and transverse arytenoid muscles, which can be seen. The transverse arytenoid is right here, and the oblique arytenoids run up on a slight angle to actually blend into the aryepiglottic folds. Now we've moved around to the anterior side of the larynx, and we're going to first of all get oriented. You can see the mandible and some of the strap muscles that you dissected in an earlier dissection. This muscle right here on top is the sternohyoid muscle, and I will pull both of those back again. Underneath the sternohyoid, you can see the sternothyroid and the thyrohyoid, sternothyroid and thyrohyoid, and I'll pull those back. And at the point where the thyrohyoid muscle attaches to the thyroid cartilage, you can see a little tiny muscle, the cricothyroid muscle, which attaches to the cricoid cartilage and to the thyroid cartilage. This muscle has a couple of heads, and the function of this muscle is to tense and adduct the vocal folds.